Guys, am I audible? Am I audible? Yeah, perfect. So let's start the next today's part of implant. We have already done two parts of implant. You can find those videos on YouTube. So I'll be continuing through the next part. That's our part 3 for today. Okay, let me just open up the comments section. Yeah. Okay, so I'll be discussing about different prosthetic options in implant dentistry first today. See guys, there are two options. One is fixed prosthesis over implants and the second is a removable prosthesis over implants. A fixed prosthesis means obviously that's a fixed prosthesis and the patient cannot remove it. A removable prosthesis is something over implants that the patient can remove it whenever the patient wants. First, let's discuss about the different types of fixed prosthesis. There are three types of fixed prosthesis, that is FP1, that is fixed prosthesis 1, FP2, that is fixed prosthesis 2, and FP3, that is fixed prosthesis 3. FP1 is the ideal most condition. If suppose there's a patient with missing central incisor and that central incisor needs to be replaced with an implant, and when it is replaced with an implant, the size of the prosthesis that would be given over the implant is exactly the same as the natural tooth was in that same patient. So it means the implant prosthesis is similar to the natural tooth when it was present. So those are known as FP1 type of prosthesis, and FP1 are the most ideal type of prosthesis that you can give it to your patients. Now second is FP2. Suppose your patient has some bone loss, and to compensate that bone loss you have to obviously give a prosthesis, a crown that is longer than a normal crown. So your prosthesis is slightly longer as compared to what the natural tooth was in the patients. So but the complete prosthesis and the crown is made up of white ceramic. There is no pink that is added into the prosthesis. So this is an example of, this is FP2 type of prosthesis. The third is FP3 type of prosthesis. In FP3, so basically the bone loss is more significant. There is a lot of bone loss, and to compensate that bone loss, again the size of the prosthesis would be bigger. And these are the patients in which the size of the crown is exactly same as the natural tooth was, but the remaining prosthesis, the remaining crown portion is made up of pink ceramic. So basically this has white and pink both into it. So this is an example of FP3 type of prosthesis. So let's see them one by one. So if you see a canine, it's been replaced by an implant here, and this canine, the crown over it is exactly of the same size of the natural tooth. So ये किसका example हो गया? This is an example of FP1. They can give you these kind of pictures and can ask you, what is this type of implant prosthesis? Is this FP1, FP2 or FP3? Now next is FP2. FP2 is, when I told you the prosthesis is bigger, longer, and is completely made up of white ceramic. These are patients, these patients in which you're planning to give an FP2 kind of prosthesis should not have a high lip line. High lip line means when the patient smiles, the gums are visible. These are not the patients that are suitable for FP2 type of prosthesis. Because if the patient is smiling and the gums are visible, so the crowns, if they are longer, they would not look aesthetically good. So FP2 kind of prostheses are not given in patients with high smile line. They are preferred in patients with low smile line. So this is the second question they can ask as an MCQ. So this is an example of FP2 kind of prosthesis. The third type of prosthesis is FP3. So in an FP3 type of prosthesis, I told you the tooth is made up of white ceramic and rest of the portion that is there, it is made up of pink ceramic or acrylic. So basically these are tooth with a white and pink in combination. So these are patients with high smile line or gummy smile. These are patients with high smile line or gummy smile. So those patients with those gummy smile, in those patients FP3 kind of prostheses are preferred. So these FP3 prostheses can be of two types. They can be of acrylic, known as hybrid implant supported denture, or it can be metal ceramic or zirconia. So it can be ceramic or acrylic. When it is acrylic, it is known as a hybrid implant supported denture, also known as an hybrid denture over implants. And the second type of prosthesis is ceramic. Ceramic could be metal ceramic or a zirconia. When for FP3 kind of prosthesis, if the space per arch is less than 15 millimeters, then I told you ceramic, that could be metal ceramic or zirconia is preferred. And if the space per arch is more than 15 millimeters, then a hybrid implant supported denture is preferred. So this is an example of FP1. This is an implant crown, same crown length as natural tooth, FP1. This is again FP1. This is again FP1. This is FP2 already discussed. This is again FP2. This is again FP2. Now this has white and pink into it. So this is FP3, and in FP3 also this is metal ceramic, PFM. So I told you when in FP3 the space is less than 15 millimeters per arch, I would prefer to give a metal ceramic or a zirconia prosthesis. This is FP3 hybrid denture. So this is a hybrid denture. It's a screw retain, means the denture is screwed over the implants, and this is preferred when the space is more than 15 millimeters. This is again a FP3 type of zirconia with white and pink. So basically I have told you there are three types of fixed prosthesis, that is FP1, FP2 and FP3. FP1 is ideally done when the arch space, it requires a space of 8 to 10 millimeters. अगर आपको FP1 prosthesis देना है, you need a space of around 8 to 10 millimeters. If you want to give a FP2 type of prosthesis, you need a space of 8 to 12 millimeters. If you want to give a FP3 type of prosthesis, the space required is 12 to 18 millimeters. These are very, very important points and can be asked in MCQ. They can specifically ask you for FP1 how much space is required. For FP2 it is 8 to 12, and for FP3 it is 12 to 18. Please remember it. Okay. The next kind of prosthesis is a removable prosthesis. A removable prosthesis is something that can be removed by the patient. So this is also known as an implant supported overdenture. So a removable prosthesis is something that has a male component that goes over the implant and a female component that goes inside the denture. Now similarly, जैसे fixed prosthesis were of three types, FP1, FP2 and FP3. A removable prosthesis are of two types, RP4, that is removable prosthesis 4, and RP5, that is removable prosthesis 5. Now what is a RP4? In RP4, you place implants and the denture, the removable denture, takes the support only from the implant bar. The denture will not rest on the soft tissue anywhere. So basically, the overdenture, the denture is taking the support only from the implant bar, the bar that is fabricated over the implant. वो उसी पे rest करेगा, कहीं पर भी that denture is not resting on the soft tissue. So basically you need 4 to 5 implants when you're planning RP4 kind of prosthesis. You cannot do it over 2 or 3 implants. Okay. So this is RP4. So can you see here in the picture? What you can see is a header clip, this yellow color. These are header clips that snaps on the bar. So this is an example of RP4 kind of prosthesis. So this is again an RP4 where the implants are placed, then a bar is fabricated over it and the denture seats over the bar. The denture will not take the support from the soft tissue anywhere. Only from the bar the denture is taking the support. So the denture is taking support only from this bar. Okay, understand? So this is RP4. So the denture is complete. The implants are joined with a bar, and the denture will take the support only from this bar. This is RP4. Okay. Next is RP5. In RP5, 2 or 3 implants are placed in generally canine region, and the denture will take the support both from the implant and the soft tissue. Now, if you see this, the denture will take the support from the implants and the soft tissue both. So, this is an example of RP5 kind of prosthesis. This is RP5. So, when 2 implants are to be placed, they are preferred to be placed in canine region. When 3 implants are to be placed, they are preferred in 2 canines and 1 of the incisors. Okay. So this is an example of RP5 where 2 implants are placed and the denture has the female component that seats over the implant overdenture abutments. For an overdenture, the minimum space that is required is 12 mm or more. Very important point. So for overdentures, the space required is 12 millimeters or more. So I told you that, see, I told you for a FP1 and an FP2 kind of prosthesis, around 8 to 12 mm of the space was required. So why do we need that space? So suppose your implant is placed here. Your implant obviously will be placed at the level of bone crest. Above the bone there is a soft tissue, gingiva. So this gingiva is around 2 to 3 millimeters. So let's take it 3 millimeters. So 3 millimeters of the soft tissue. Then over this there is the abutment. This abutment height should be at least 5 millimeters for the cement retention. So 3 mm of soft tissue plus 5 mm of abutment height. And whatever crown I will make, whether I will make metal ceramic or I make a zirconia, it should be around 1.5 to 2 millimeters. So 2 mm of occlusal material. So 3 plus 2 plus 5 around 10 millimeters. So that is why above the implant level you need a clearance of 8 to 12 mm for fabricating a crown. Okay. अगर इससे कम space है, so it is very difficult to fabricate a crown. So अगर पूछते हैं for making an implant crown above the implant level how much space is required, the range is 8 to 12 millimeters. In 8 to 12 millimeters, this 3 mm is the soft tissue thickness, 5 mm is the abutment height, and 2 mm above is the crown occlusal material height. Okay. If the crown height space is less than 8, I told you this range is 8 to 12. अगर ये crown height space 8 mm से कम है, but 5 mm से ज़्यादा है, then I would not make a cement retained prosthesis. Then I will make a screw retained prosthesis. If you they ask you a question that suppose a first molar is missing in the patient and you replace it with an implant, and after that when you are trying to give a prosthesis and you saw the prosthetic space, the clearance was 6 mm. So what is the type of prosthesis you will give it to the patient? So answer here would be screw retained prosthesis. So more than 5 and less than 8 mm, answer would be screw retained, and more than 8 mm, then answer would be cement retained prosthesis. Okay, so I just told you that for an hybrid, I told you hybrid ke liye you need a space more than 15 millimeters. So in FP3 there were 2 types of prosthesis. One was ceramic, ceramic के लिए space 15 mm से कम चाहिए था, and for hybrid space required was more than 15 millimeters. Now, why do you need space more than 15 millimeters for hybrid implant supported denture? Very important picture and a very important question to be asked in exams. So, 3 mm again of soft tissue, 3 mm of soft tissue here. This bar that is there in hybrid denture is around 5 millimeters. So 3 plus 5, 8, and these acrylic tooth above this bar is around 8 millimeters. So 8 plus 8, 16. So it means when I want to make an hybrid implant supported denture, I need a space more than 15 millimeters. Then only I can make a hybrid implant supported denture. Otherwise, I cannot make it. So please remember by heart, for an hybrid implant supported denture, the space required is more than 15 millimeters. Okay, now they can ask you one more question. You know a principle of crown height ratio for a natural tooth. Auntie's law. What is this law? That the root should be bigger and the crown should be smaller. The root should be bigger and the crown should be smaller. So, in implants, it is not very significant because in a natural tooth there is a periodontal ligament, but in implants there is no periodontal ligament. The implant is ankylosed with the bone. So the maximum, very important point, please remember, the maximum forces are at the crestal 4 to 5 mm of the implant. The maximum forces are at the crestal 4 to 5 mm of the implant. It means even if my implant is 10 mm, 15 mm, 20 mm, forces to crest ke 4 mm या 5 mm पे होंगे. That is why you have never heard my implant is tender on percussion. You will never hear my implant has a sinus tract. Your implants will always have the crestal bone loss at the crest whenever the forces are beyond the adaptive capacity of that implant, or whenever there is any peri-implantitis, the maximum bone loss is at the crest. So if my crown is bigger, then also my forces are at the crest. So because it is ankylosed, crown is to implant ratio is not as significant as like it is in natural tooth. So my FP1 is obviously smaller prosthesis and my FP3 is a longer prosthesis. So my FP1 and FP3, the crown is to implant ratio will not have very significant importance. Okay. Now next important point, very important, please remember. See, the width of the implant is more important than the length of the implant. The width of the implant is more important than the length of the implant. Please remember 0.5 mm increase in width of the implant, 0.5 mm increase in width of the implant increases the surface area of the implant by 15 to 20%. 0.5 mm increase in width of the implant increase the surface area of the implant by 15 to 20%. Similarly, 0.1 mm increase in length of the implant, 1 mm increase in length of the implant will increase the surface area by just 2 to 3%. So that is why the width of the implant is more significant, and also the maximum forces are concentrated at the crestal part of the implant. So then also the width becomes more significant. So the width of the implant is more significant as compared to length. So if they ask you a question, 0.5 mm increase in width of the implant will increase the surface area, answer would be 12 to 15%. And if they ask you a question, 1% increase in length of the implant, the surface area of the implant will increase by, the answer would be 2 to 3%. Okay. Now a very important slide. This is the difference between tooth and an implant. And I have seen one or two questions every time from this picture in the exams. The first difference in a tooth has cementum, bone and periodontal ligament, but implant is ankylosed with the bone. There is no such structure. In a tooth, there is hemidesmosomes and basal lamina. In implant also, there is hemidesmosomes or basal lamina. So it is present in both. Now the next important point, the fibers, the gingival fibers. In connective tissue of tooth, there are 13 group of fibers. But in implant, only 2 group of fibers are present. Only circular and parallel. No other fibers are present in an implant. Biological width for a tooth is 2.04 mm. So what is a biological width? It is a sum total of junctional epithelium and connective tissue. The width of the junctional epithelium is 0.97 millimeters and the width of the connective tissue is 1.07 millimeters. So the sum total becomes around 2.04 millimeters. But in an implant, the biological width is more. The junctional epithelium is around 1.88 millimeters and the connective tissue is around 1.05 millimeters and the biological width becomes around 3.08 millimeters. So it means in an implant the biological width is more. Now the vascularity of a tooth is more and an implant is less. The probing depth for a tooth is around 3.05 millimeters. Probing depth in an implant is more, around 2.5 to 5 millimeters. The bleeding on probing is more reliable in tooth as compared to an implant. So please remember these points. These are all very important. Okay. Next important topic is bone density. So now, if you see bone density, there are 4 types of bone density: D1, D2, D3 and D4. This classification was given by Mesh. There are 4 densities of bone: D1, D2, D3 and D4. D1 is dense cortical, D2 is porous cortical, D3 is coarse trabecular and D4 is fine trabecular. D1 is hardest and the D4 is the softest bone. Okay, so D4 is the softest bone. If you see this picture, these are sagittal views of CBCT section of mandible. इसमें देख लो पूरा रेडियो ओपेक दिख रहा है. This is D1 bone. इसमें everything is radio opaque. Center में there is radiolucency. This is D2 bone. So D1 bone is never observed in maxilla. It is only seen in mandible in anterior symphysis region in only 4 to 6% of the cases, not much. Most of the mandible is D2 bone and D2 bone is the best bone for implant placement. It is not the D1 bone. D2 bone is the best bone for implant placement. D3 bone is in maxilla and D4 bone is in posterior maxilla. So this is D1 bone and this is D2 bone. D3 bone, can you see it is how much trabecular? This is D3 bone. And this is D4 bone. When you see a D4 bone, it is very thin cortical bone and inside it is highly trabecular. This is D4 bone. This is how a D4 bone looks in a dried skull. See how porous it is. So when you drill through it, it is very soft. A very important chart. Please remember it. One question lot of times in the exam from this. So a D1 bone is a dense cortical bone. It is compared to oak or maple. So what Mish has done, he has compared woods, different types of bone to different wood. So D1 is oak and maple type. It is seen mostly in anterior mandible. And if you want to see the strength of this bone, the CT value, the Hounsfield value in those regions is more than 1250. So they give you a question, the HU value of 1450, what kind of bone it is. So you need to know, remember it is D1 bone. Similarly, D2 bone is porous cortical and coarse trabecular. The bone is of it is similar to white pine and spruce, seen in anterior and posterior mandible and interior maxilla, and the value is between 850 to 1250, the Hounsfield value. So please remember the values. The D3 bone is porous, cortical and fine trabecular bone. It is porous, cortical, thin and fine trabecular bone. It is compared to balsa wood seen in posterior mandible and anterior and posterior maxilla. Okay, and the value is between 350 to 850 Hounsfield unit. Next is D4 bone. It is fine trabecular, like a styrofoam, very soft. It's seen in posterior maxilla, and the Hounsfield value is between 150 to 350. 150 to 350. Okay. Now next is BIC. What is BIC? That is known as bone implant contact. So the time you place that implant in the bone, it's not that complete implant is in contact with the bone. Only a small portion of implant comes in contact with the bone, and this is known as bone implant contact. More the bone implant contact, more would be the primary stability, more would be the stability of your implant. Please remember, when you place the implant, if your implant is moving more than 50 to 100 microns, so it is not good. So if they ask you a question, how much micro strain on your implant is okay, so the micro strain of 50 to 100 microns is ideal, and this helps to convert the woven bone to lamellar bone, and it converts faster. So कितना movement allowed है implant का bone में 50 to 100 microns. Okay, so more the BIC, more would be the primary stability, and denser the bone, more the BIC. Okay, so it means D1 bone will have maximum BIC and D4 bone will have minimum BIC. Now in case the bone density is less, अगर bone density कम है तो हम उसको कैसे compensate करेंगे? So what I'll do is, if my bone density is less, I will increase the total surface area of my implant. So if my bone density is less, I will increase the surface area of my implant. And how could I do this? I can place more number of implants. I can increase the number of implants. I can increase the width of the implant, because I told you a 0.5 mm increase in width of the implant will increase the surface area of the implant by 10 to 15%. I will increase the implant length. I will increase and use an implant with a lesser pitch, more threads, and I will increase and use an implant that is more rough. So when I do all this, the surface area of the implant will increase and the bone density will be compensated, that was less in a particular case. Please remember, you cannot connect a natural tooth to the implant. You cannot connect a natural tooth to an implant. Because when you connect a natural tooth to an implant, your implant does not have a periodontal ligament, but your natural tooth has a periodontal ligament. Okay, so this will lead to biomechanical complications in your implant, and even your natural tooth can fail. Please never connect your natural tooth to an implant. Okay, so I think we have covered a lot of things today in implant. So I have told you about the different prosthetic designs. I have told you about the different bone densities and how to deal with the bone densities, how to understand what is the bone density. So just go through with this again, and if you have any doubts, ask me about all these points. Next time I'll be telling you about at which all positions you have to place the implants. I'll tell you the principles of implant placement in the next lecture about implants. Okay. Thank you so much for today.